Starting hospice care can feel overwhelming, and you may meet a lot of new faces. However, knowing your care team and their roles can help you feel more at ease during the end-of-life journey. At Inhabit Home Health and Hospice, our hospice care team takes the time to understand each patient's needs and what matters most to them. We use an interdisciplinary approach to implement a care plan that best serves patients and their loved ones throughout their end-of-life journey. From nurses to social workers to volunteers, our compassionate team is committed to ensuring patients and their families receive the physical, emotional, and spiritual care they need and deserve. So let's meet the hospice care team at Inhabit. Medical Director. Medical directors are physicians who certify that patients have a prognosis of 6 months or less left to live. Additionally, they consult with other physicians involved in the patient's care plan and educate or guide care measures with the rest of the hospice care team. They consult and collaborate with the care team and attending physician regarding care, medication management, and pain and symptom relief. Attending physician. Attending physicians perform the same duties as the medical director, certifying that the patient has a terminal illness and less than 6 months left to live. They will also continually assess patient needs, manage symptoms, and prescribe treatment and medication, all while coordinating with the rest of the hospice care team. The attending physician can be an outside physician that the patient or caregivers prefer to coordinate and manage their care. Patients can also elect to use Inhabit's medical director as their attending physician for hospice care. The patient chooses them as the most influential physician in determining and directing their care plan. Skilled nursing. The nursing staff is made up of registered nurses, licensed practical nurses, or licensed vocational nurses. They work together to determine patient needs and ensure the customized care plan is being followed. Nurses will also provide skilled nursing services. These include disease process education, medication management, safety precautions, wound care, and skilled treatments such as catheter or ostomy care. Lastly, they will coordinate care with the rest of the hospice care team, making sure all individuals know what will best suit the patient's needs. Medical social worker. Social workers don't provide physical care. Instead, they assess the emotional, social, and financial needs of patients and their loved ones. Whenever they identify a lack of resources, they can connect the patient or their loved ones to the appropriate community agencies to get further support. As a trained mental health professional, they can also provide direct counseling and bereavement support to patients and their loved ones. Hospice aid. Hospice aides provide personal care and comfort measures, including helping with hygienic routines and keeping wound dressings clean and dry. They will also report identified needs to the registered nurse or case manager and provide emotional support to patients and their loved ones. Chaplain. Hospice chaplains are experienced professionals who plan, assess, and care for a patient's spiritual needs during their end-of-life journey. They provide counseling to both patients and their loved ones, consultation with the clergy community, and assistance with memorial preparations. Volunteers. Hospice volunteers provide companionship and emotional support to patients and their loved ones through non-medical services. This can look like sitting with a patient, running errands, walking family pets, assisting with light house cleaning, or writing a journal with patients. Volunteers can also provide respite time for caregivers and family. Therapy. The therapy team is made up of physical, occupational, and speech therapists. They assist with the comfort needs related to decreasing functional ability by evaluating and providing solutions for safety concerns in the home. Therapy needs aren't as common in hospice as they are in home health, but therapists are available to assess any therapy need and provide home safety solutions. The end-of-life journey can be difficult to navigate, but our hospice care team is there to help make the last moments of life special. For more information about Inhabit's hospice services, please visit inhabit.com.